This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses or simply click on the link in our show notes and create an account.
All right, good morning, everybody. This is Ryan Circh for another Medical Minute. So I got an interesting case the other day. I'm going to run through the scenario and I'm going to see what you guys think. I had a kid, about 10 years old, recently diagnosed with asthma and was coming in with URI symptoms. Nasal congestion, sore throat, fevers, some coughing. It's been going on for a few days, and Mom was worried because he was having trouble breathing that day. So we'll just stop there. What are your thoughts? Recent asthma, URI symptoms, what are the things we got to worry about? Throw out a couple ideas.
Exacerbation, decompensating.
So yeah, the biggest one would be asthma, just an asthma exacerbation from the viral URI. He's got the fever, so we're thinking, maybe he's got pneumonia. Unlikely, but additional stuff like pneumothorax, that sort of thing. I go into the room, I see the patient, and he is pretty tachypnic. He's breathing like 40 times a minute. Oxygen saturations are fine, though. I listen to his lungs, and he does have some wheezing, but it seemed very much out of proportion to the rapidity of his breathing, the tachypnea that he's got. So I was like, all right, well, we're going to give him a neb. And I started kind of scratching my head, like, what's going on here? Something doesn't fit. He's too tachypnic for this to just be asthma. So obviously pneumonia is still on the list, but any other kind of more zebra-y type ideas as to why a 10-year-old would be super tachypnic and it not be from asthma or pneumonia or anything like that?
Allergic reaction.
Allergic reaction, good thought, was not that. So what if I told you we checked a finger stick and it was undetectably high? He had new onset pediatric DKA. And so instead of an asthma exacerbation, he had an unmasking of previously undiagnosed diabetes. And so I just wanted to briefly kind of go through, since not a lot of us don't see a lot of peds, since we have the peds wing, peds DKA, because I hadn't had it in a long time either. So the biggest thing that I would emphasize for you guys is fluids. We dump fluids into adults with DKA, right? Liters and liters and liters. With these kids, we worry about cerebral edema, and we're still not quite sure why they get the cerebral edema, but it's thought to be the speed at which we give them fluids. So generally what we're doing is 10 mils per kilogram bolus, and then you just start maintenance fluids. So just be really gentle. So this kid was, I can't remember how many kilos, but he really only needed like a 400 cc bolus, and then you start maintenance fluids, right? And so we're just so used to dumping fluids in patients. Just be really gentle with fluids. And then the rest is just normal DKA care, right? So we'll start the insulin drip. It's 0.1 units per kilogram per hour. Generally don't bolus. Supplementing potassium even when potassium is normal, right? Because you have the hydrogen potassium shifts when they get really acidotic. Very rarely are we going to need bicarb, usually if it's a pH less than 7, but even this kid, he had a pH of 6.9, and we just left it alone because he was compensating decently. And then ultimately, they're going to need to go to the ICU. So really just the moral of the story is, if you have a gut feeling about something or something doesn't fit, no matter what the case, whether it was this case that ended up being DKA or other cases in the future, don't just exclude it because, it's probably not that. Certainly bring it up to the provider that you're working with and keep pursuing the concerns that you might have. Questions about any of that?
On that bolus, are we giving it quickly?
Yeah, just a normal bolus. But, just again, the emphasis on stopping at the 10 cc's per kilo. Anything else?
Makes total sense.
All right. Have a good day, everybody.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.